Welcome to this explainer. We're jumping right in today because we are embarking on a truly incredible evidence-based exploration of the complete journey of women's health. We're looking at the entire timeline here, folks, from adolescence all the way through to older adulthood. We're going to break down the science, we're definitely going to bust some deeply ingrained societal myths, and we'll look at exactly how modern medicine supports women at every single stage of life. It's a fantastic topic, so let's get started.
Okay, let's dive into this. Here is our chronological roadmap for today. First, redefining women's health. Then, puberty and menstrual cycles. Third, navigating pregnancy and reproduction. Moving on to menopause and later life. Then we'll cover common disorders and care. And finally, prevention and future innovations.
Section 1. Redefining women's health beyond reproduction.
You know, for the absolute longest time, women's healthcare was viewed purely through a reproductive lens. Like, that was it. In fact, it wasn't until surprisingly recently, think the early 1990s in the US, for example, that women were even mandated to be routinely included in broad clinical research. Crazy to think about, right? But true women's health encompasses so much more across this lifelong spectrum. As we see here, we go from adolescence and puberty, into adulthood and the reproductive years, transitioning into midlife with perimenopause, and finally right into older adulthood and postmenopause. Care extends far beyond just pregnancy. It is really about lifelong physical, mental, and social wellness, getting those early diagnoses and targeted prevention at every single one of these distinct phases.
Moving right along to Section 2, Puberty and menstrual cycles, the foundation.
So, the menstrual cycle breaks down into 4 sequential phases: follicular, ovulation, luteal, and menstruation. This entire loop is basically a beautifully complex dance regulated by key hormones. Estrogen and progesterone are constantly ebbing and flowing, while chemical messengers from the brain, specifically FSH and LH, continually communicate with the ovaries to manage the whole shebang and keep things running smoothly.
But hang on, this brings up a really important question, one that affects literally millions of people globally. Are painful periods always normal? It's something society often tells women to just, accept and push through.
Let's absolutely bust that myth right now. While mild discomfort is super common, severe pain, which is clinically known as dysmenorrhea, is not normal. It can actually indicate underlying medical conditions that really require professional care, things like endometriosis or adenomyosis. This brilliantly illustrates why self-advocacy matters so much in healthcare. Bottom line, if the pain is disrupting your daily life, it 100% warrants a proper medical evaluation, not just a casual dismissal.
All right, Section 3, Navigating Pregnancy and Reproduction, Care and Recovery.
Now, during these reproductive years, a really common hurdle is polycystic ovary syndrome, or PCOS. It's a hormonal disorder that frequently causes irregular periods. Now, what's really interesting about this slide is how we actually manage this in a clinical setting today. Consider a young woman coming in with irregular cycles and getting that PCOS diagnosis. Well, her care doesn't just stop at the diagnosis. It involves a highly tailored plan. We're talking lifestyle changes, targeted medication, and if she's trying to conceive, specialized fertility counseling to help her successfully navigate her own reproductive goals. And if a woman does go through pregnancy and delivery, the care absolutely cannot just stop the minute the baby is born. Imagine a postpartum mother dealing with stress urinary incontinence, meaning she leaks urine when she laughs or sneezes, and severe lower back pain. Instead of just telling her, oh, well, that's normal after having a baby, a true evidence-based approach utilizes multidisciplinary techniques. This includes pelvic floor physiotherapy to actively rebuild strength, targeted exercises for diastasis recti, which is that separation of the abdominal muscles you might have heard of, as well as biofeedback, posture correction, and absolutely crucial mental health support. This is what true comprehensive recovery actually looks like.
Section 4 already? Menopause and later life, a natural transition.
Let's demystify the 3 stages of the menopausal transition because there is a lot of confusion out there. First up is perimenopause, where hormones are wildly fluctuating, causing mood changes and irregular cycles. Next comes menopause itself, officially defined as going 12 consecutive months without a menstrual period, and this is often accompanied by those famous hot flashes. Finally, we have postmenopause. Notice how the clinical focus shifts here. It moves heavily toward the long-term surveillance of bone loss, preventing conditions like osteoporosis, and maintaining cardiovascular health, especially as the protective effects of estrogen begin to decrease.
And just like we did with puberty earlier, we need to address a critical myth here. The myth that menopause is some sort of disease to be cured. The fact is, menopause is a completely natural stage of life. However, and this is a big however, while it's natural, that doesn't mean anyone has to just suffer through it in silence. Symptoms like hot flashes, vaginal dryness, and sleep problems are very real, but there are numerous evidence-based treatments, hormonal therapies, and specific exercise programs designed to effectively manage them and keep your quality of life incredibly high.
Let's move into Section 5, Common Disorders and Care, Seeking Multidisciplinary Help.
First up, the pelvic floor. This is a critical group of muscles and ligaments, specifically including the levator ani and the coccygeus. Think of it as kind of like a muscular hammock, actively supporting the bladder, uterus, and rectum. Now, a massive misconception out there is that pelvic floor exercises are only for older women. Actually, scratch that. It's entirely false. Pelvic floor health benefits women at every single stage of life. Whether you're a young athlete dealing with core instability, a postpartum mother, or navigating postmenopause, it's for everyone.
We also absolutely have to talk about women's cancers, which require highly specialized long-term care. Consider this vignette from a postmenopausal patient. Following my early-stage breast cancer diagnosis, surgery and lymphedema rehabilitation gave me my life back. I think this just perfectly humanizes cancer care. It's not just about surviving the initial diagnosis and those primary treatments like surgery or chemotherapy. It is intensely about long-term survivorship. And that means focusing on lymphedema management, shoulder rehabilitation, and targeted fatigue management so that patients can truly, fully get their lives back.
And that brings us to our final section, Section 6, Prevention and Future Innovations, Empowering Your Journey. The global guidelines from massive authorities like the World Health Organization, the CDC, and the American Cancer Society are crystal clear. For cervical cancer, it's HPV testing and regular pap smears. For breast cancer, clinical exams and mammography. For bone health, DXA scans to catch osteoporosis early. So the crucial point is this. Adhering to these specific screening guidelines quite literally saves lives. Prevention really is the ultimate cornerstone of lifelong women's health.
And you guys, the future is incredibly bright. The innovations happening right now are driving women's healthcare forward at absolute lightning speed. We are talking about precision medicine and genetic screening that actually tailors treatments exactly to your DNA. We're seeing artificial intelligence revolutionizing diagnostics, catching things the human eye might easily miss. Robotic and minimally invasive surgeries mean way faster recoveries. Telemedicine is vastly improving access to care for people everywhere, and advanced personalized cancer therapies are changing prognoses entirely. We have come so incredibly far from those historical, one-size-fits-all treatments, and it is thrilling.
To wrap up our journey today, I want to read this really powerful conclusion drawn directly from our source material. By investing in women's health, we strengthen families, communities, and future generations. It's so true. When we utilize individualized, multidisciplinary care, the macro-level impact on society as a whole is just profound. Which leaves us with one final provocative question for you. What step will you take today to advocate for your own health journey? Whether it's booking that overdue screening, asking your doctor about a lingering symptom you've been ignoring, or simply prioritizing your daily nutrition and movement, you have the knowledge. Now it's time to use it. Thank you so much for joining me on this explainer. And take care.